Welcome to the first episode of this podcast series, Canada Uncovered, with your host, Arisha, where we discuss and uncover issues that lie within Canada. In today's episode, we're tackling a critical topic, the mental health crisis facing Canadian children and youth. When I was 8, mental health really became a prominent area in my life. I was growing up and going to school with a neighbor of mine who I was very close friends with, and she was a very lively and energetic person. However, as the days passed, me and the people around her took notice of the differences in her behavior. She slowly became withdrawn and anxious, burdened with worries that no child her age should have had. Her family wasn't open to discussing mental health, and this made it even harder for her to get the support that she needed. Teachers noticed this too, but it wasn't until she started talking about wanting to be dead that this raised an alarm. This was a very unsettling and complex emotion for anyone, especially her at that age, to be feeling. And because this was all taking place during a time when children and youth mental health weren't being as discussed, there weren't many options to get her checked. However, she was later diagnosed with trauma-induced anxiety. Now, this was a scary experience for anyone who saw it, and I think this is what opened my eyes and many others to the concept of mental health, and that it is something very real indeed. So, this brings us to the issue at hand, the rising mental health crisis among Canadian youth and the obstacles they face in accessing meaningful help. In Canada, around 1.6 million children and youth are diagnosed with a mental health challenge, yet only 75% of them lack access to specialized treatment services. Untreated mental health issues in these early formative years can lead to lifelong challenges. These years are critical to building the foundation of a healthy life, and so without intervention, there's a ripple effect, not only on these young individuals, but on their families, their communities, and society as a whole. So why is this such an important issue? Mental health is a core part of our overall well-being, and addressing it early helps prevent complications later in life. Poor mental health among young people can lead to academic struggles, substance abuse, and even suicidal thoughts. And by supporting youth mental health, we contribute to better educational outcomes, a more prepared workforce, and lower long-term health care costs. Right now in Canada, mental illness-related leave prevents nearly 500,000 Canadians from going to work each week, and this is a heavy burden on our economy. But why is this issue growing? Young people today face unique pressures from academic stress to the pervasive influence of social media. The COVID-19 pandemic only added to this, and it made things quite worse. Access to mental health services remains a challenge, particularly in rural or low-income communities, and while discussions around mental health are still growing, stigma holds people back from seeking help. For many, mental health is seen as a personal issue rather than a legitimate health concern, and our healthcare system often prioritizes reactive care rather than preventive support, meaning minor issues are left to escalate into crises. Despite these challenges, there have been successes. Mental health stigma is slowly decreasing, and mental health in schools is improving, with counselors and other resources becoming more common. Telehealth services are making mental health care more accessible, and as governments invest more in this area, new support systems are beginning to emerge. Yet, we still face barriers. While stigma is lessening, it remains strong, especially in some communities. The shortage of trained mental health professionals means demand often outweighs available resources, and for many, accessing these resources, particularly in rural or economically disadvantaged areas, are still difficult. And to address this, we need proactive, accessible resources, starting with mental health days in school. My friend shared that she would have been benefited from mental health days, giving her the reassurance that taking a break was not only allowed, but was always an option. Schools could also gain insight into how often students need these breaks, and additionally, mandatory mental health training similar to CPR certification in schools and workplaces could also make a tremendous difference. So, do you have thoughts on this pressing issue? I hope today's episode is a call to action for you, a reminder of the urgency of addressing youth mental health in Canada. Thank you for tuning in to Canada Uncovered, and I hope this discussion stays with you. See you next time.